Hello, I'm Ken. I'm with Oskaloosa News, and I'm here with a couple of providers from Mahaska Health. We have Dr.
Tim Breon. I'm a general surgeon and the chief medical officer here.
I'm Arthur Zahadish. I'm a nurse practitioner in occupational and employee health at Mahaska Health.
So I've asked these folks to kind of join with me a little bit so we can kind of talk about what's going on with COVID in our community right now. And Dr. Breon, I'll start this out here with, generally speaking, how's COVID impacting our communities and the individuals that live within it?
Yeah, I think COVID was a huge deal last year, so we all kind of went through that whole process. It was pretty exhausting for all of us that were here at the hospital. And then it seemed like COVID kind of went away, so to speak. And many people were not talking about it much, and it just became one of those things that we didn't have to address on a day-to-day basis. And then all of a sudden, the Delta variant became something that we started hearing about, and sure enough, the Delta variant has become an issue for our own community. We don't know what the effect of that is going to be yet because we're just kind of fresh off the state fair, and we're also just getting back to school. So right now, the impact of our community is not as bad as some of the higher population communities that have really been hit with the Delta variant. So some of the bigger cities, certainly southern Missouri, Springfield, Missouri, New Orleans, some of these hot spots have been really hit, and it's really affecting the way that they can provide health care.
There's been recent talk, a third shot. Is it a booster? I mean, what exactly are we looking at? And who will be qualified and be eligible for that? And when will we do more?
So the CDC recently provided some guidance for that, and the individuals now that are qualified for their third dose are those that are moderately to severely immunocompromised. There's specific criteria that they've outlined that qualifies those patients. Okay, the third dose is for those that immune systems may not make adequate antibodies, and they'll need a third dose of one of the mRNA vaccines, the Pfizer or Moderna. As of yet, there is no guidance yet for Janssen or the Johnson & Johnson vaccine, and that's expected to come in the next few weeks. That is the third dose, okay? And you're eligible to receive that 28 days after your second dose, if you're moderately to severely immunocompromised. A great resource would be our public health department or your primary care provider, okay? To see if you are in that category. The booster dose that they have also mentioned, this is essentially another dose of one of the mRNA, the Pfizer or Moderna vaccines, for those that have normal functioning immune systems, but that received their second dose approximately 6 to 8 months ago. Okay, we know that the antibodies produced from vaccination decrease over time, but they last much longer than if you were infected with COVID. Okay, the antibodies after COVID infection are projected to be anywhere from 1 to 3 months. From vaccination, you're looking at anywhere for closer to 8 months to a year of protection. That's why vaccination is so important. These are expected to roll out the week of September 20th. And most likely the plan will involve those at highest risk or who have the most exposure. So healthcare workers, frontline workers, as well as our long-term nursing care facility residents.
Okay.
I've also, and I'd like to, just comment on something that Arthur mentioned, that there is a difference in the immunity that you get from contracting the illness, building immunity from that, and the immunity that you get from the vaccination. So a lot of people are asking, well, why do I have to get the vaccine? I've already had the virus. And so he already explained why that's a fact. And there's a difference. There's a reason why they made the vaccine a specific way and a specific pattern so that it recognizes specific protein on the surface of the virus. And when you acquire the virus and you build your own immunity to it, the things that you may build immunity to it may not have anything to do with specific things in the virus that can provide appropriate immunity or longer lasting immunity. So the vaccine is actually built in a way to give you immunity that lasts longer than you would if you just acquired the virus. And so it's important for people that have had the virus, they don't think that they need to be vaccinated. It still is beneficial for them to get vaccinated as well.
Okay, very good. So, Arthur, maybe you can tell me then, how will the hospital here be involved with that?
Sure. We're currently already giving third doses to our mildly and severely immunocompromised residents of the community. Please call in. We can get you scheduled for a same-day shot with your primary care provider. If you're unsure if you qualify for a third dose, well, please go ahead and call in. Our nursing staff, your primary care provider can help, as well as our public health in determining whether you're qualified or not. The booster doses that are expected in late September, we'll have a vaccination plan for that as well, but those have not been authorized yet per the CDC. But basically, if you have questions, please call in and we can better guide you and get you set up for getting vaccinated here.
Okay. Well, doctor, I'm going to ask you, because you kind of have this position around here. So, so what are some of the things that the facility here is going to be doing to help protect its staff?
You know, the facility here has been excellent in the care of its own staff since the outset. You know, we have kept everybody here working, and never really was able, or we didn't have to furlough anybody, so we kept everybody in position here, and we used those people in screening areas, and so we just were able to keep our staff. So now we still have all those staff to use, and so it's really important for us to keep those staff as healthy as possible. We encourage vaccination among our own staff, just like we encourage it among, we continue to encourage people here, and we have a higher vaccination rate in the hospital than is in the county. Certainly, you know, if anybody has symptoms, we go through Oskaloosa Health and they clear them of their symptoms. They test. We frequently are testing our staff to make sure that their symptoms are not COVID related. People can just get the cold, and we see a lot of that. And I'm not sure what percentage of people that you see that have some of those symptoms that you see are actually COVID positive. I don't know if you have any idea with that, Arthur.
Yeah, it varies, you know, but you know, just because you have the sniffles or you think it's your allergies or whatnot, it's better to be evaluated from an employee standpoint or also a general member of the community.
So we're doing everything with our staff that we can to keep them as healthy as possible.
So COVID-19 has had an emotional impact on just about everybody. So how are you helping your staff, your patients, and even the community as a whole through all of this? Because, I mean, we've lost loved ones, we've lost kind of a way of life. I mean, there's just a lot of emotional impacts that have been taking place.
That's an interesting question, you know, and I think those emotions come out in a variety of ways. But I think some parts of the hospital have been affected more than others. You know, it just depends on what your level of care and interaction with COVID-related patients has been. But I think you mentioned, you just stated in your question, that it's been hard on everybody. So even our patients, we know that they're struggling sometimes with that for the reasons that you stated. And so I think we probably haven't understood the full breadth of the impact that this has had and will continue to have for a while on our staff. We just know that we're always paying attention to our staff and making sure that we're doing all we can in those circumstances, particularly where nurses have been dealing with a lot of death that we saw, especially last year with COVID patients. And then also even considering how we're going to continue to keep our staff safe going forward. OSHA has been involved in regulations now for hospitals just to make sure that staff are safe. And so they've even instituted some regulations that we have to abide by that other institutions or other organizations in the county don't have to. So they encouraged healthcare providers and hospitals to do safe practices to keep all of their employees as safe as possible from an OSHA standpoint, which they weren't even a player in this up until just recently. So now, based on just keeping staff safe, we have new regulations that we have to consider. Mask wearing in the hospital is one of those recommendations that OSHA made before the Delta variant became known. And so, you know, doing all those things and just being aware of the fact that this has just been hard on everybody. You know, when patients come in, we know that sometimes they're struggling with things, and then when it comes down to it, they finally will start asking questions about COVID because they've been afraid to ask their doctors about COVID because they have so much information from everybody else about it. They don't really want to know the real answers, maybe, because I think we do have the respect of the community, and when we give a solid medical-based answer that's basic vaccine knowledge and basic biology that's just always been in the works since the beginning of vaccines being administered. And vaccines are a good thing. You know, they've saved countless lives. There are some risks associated with vaccine, but there are risks associated with driving to the hospital, and there are risks associated with taking the medications that we take, and there are risks with eating fast food, and there are risks with smoking and drinking and driving, and all those risks are things that we assimilate, and the risks of the vaccine are much, much, much less than the consequences of not getting it, and that's just basic medical knowledge. And so it's hard to have some of those discussions amid all the other discussions that have arisen during this time, because it's the first pandemic that's ever been a big issue in our country since social media became apparent. It's a whole new thing, and it's a new challenge for all of us, and we're trying to work through it with respect for our patients and with respect for our community, but also with respect for our staff that work here that we want to keep safe, and with respect to the ability that we have to provide medical care to our community in a safe and effective way, considering all the concerns that we have about their medical care, including vaccinations and including all their other issues. So that's a big answer to a big question, but it's been a challenging time, and we certainly appreciate all of our staff. We appreciate Arthur, who deals with it every day, and people like him that remain positive in the midst of a very challenging situation. We have staff like Arthur that are encouraging to staff, and they're encouraging to patients, and we just have learned probably to listen to our patients better than we ever have, because we about have to.
And very well said, Dr. Bruno. Thank you for the kind words. The only thing I'd add is that there's been a lot of pain in our community, and we've all felt it, and we're all working hard to keep not only us safe, but our children, our families, and have these discussions. Consider getting vaccinated. If you have questions, barriers, issues, let us know. We can help address those. We're here for you guys. And that's the biggest thing, is that there's many family dynamics and things that I'm not sure about. These are great questions. We have a lot of experts here, not only in vaccines, finding the right vaccine for you, when is it appropriate, how does it work, but the thing is that COVID is not going anywhere, and we have great vaccines available in this community that can really change the wave and turn the tide here, and kind of help our entire community and keep our kids going back to school safely, keeping our most vulnerable patients out of the hospital and staying at home. And so we really offer, my heart goes out. A lot of people are struggling, and they've been struggling, and we see that. We see that every day. And so we're here as a resource, and have those discussions, and please call in, and so we can answer those questions and help.
Arthur, so folks think that maybe they have COVID, so they come here. So how do they go about testing? Do they go to the emergency room? How does this happen?
So emergent symptoms, new shortness of breath, trouble breathing, discoloration of the lips, bluish hue to the fingers, nails, new unresolving chest pain. Those are all emergent signs or symptoms that warrant emergency evaluation. And they could come to our emergency department here at Mahaska Health. If you're concerned about COVID, either through exposure, or you've developed symptoms after exposure, and exposure is really considered 15 minutes within a 6-foot distance over a 24-hour period, okay? And so outside, not really. You think more of confined spaces and schools, the workplace. And we have a walk-in clinic here that can better help evaluate whether you qualify for COVID testing, and we offer different kinds of COVID testing. The other important thing is to also check if you're concerned about returning to school, quarantine, isolation, or returning to work. We can help give guidance on that. A good resource is also our public health department, as well as your primary care provider. We've all been in this, and we have clinicians and experienced staff that can help answer questions and provide guidance. We can also help get you tests. The state has moved away from the state testing sites, but they've offered in-home testing kits, which we distribute here as well.
Okay. So the vaccination, it's ongoing in our community, in our county, and how's the county doing with those? And what's the current vaccination rates here within Mahaska County?
Completely vaccinated, we stand at about 36% in Mahaska County now. That's to be compared with the state rates of all vaccination rates of 49% roughly. We're still vaccinating people here. We still have people coming in for their first vaccinations, probably more concerned with the Delta variant. We would love to see those rates go up even higher. We would love to have more people get vaccinated. But once again, we're still lagging behind, and we're doing our best to make sure that we can facilitate that for people that are interested in having the vaccine.
Okay. So there's been concerns over the vaccines, and the FDA has now approved the Pfizer version. So what would you tell your patients or someone watching or listening today about the current vaccines, and to help them in their decision-making process through this?
Sure. So the Pfizer vaccine received full FDA authorization just recently, and what that means is this authorization is for individuals 16 and over. It still has the emergency use authorization that was originally granted in December of 2020 for ages 12 to 15. The FDA did not cut any corners in this review process. They gave its full mark of approval after 24/7 review and over 100,000 pages of data that was reviewed, as well as inspections of facilities where these vaccines are produced. We expect Moderna to come shortly, and the Janssen Johnson & Johnson, it was originally authorized 70 days after the Pfizer, so we expect that approval as well coming up. And to the second point is that, everybody has their own past medical history. The contraindications or the reasons not to be vaccinated are very limited for COVID, which is great. A lot of people qualify to be vaccinated. They may have concerns about previous vaccinations or reactions they've had. These are excellent questions to bring up to your primary care provider, our public health department, or other clinicians in the hospital that are aware of the current societal guidelines. You have questions of infertility, pregnancy. Is this right to take now? I'm lactating, or breastfeeding. I'm unsure if this is safe. Please let us help you. Just reach out to us, and we can provide some guidance. We also have a great resource where the federal government has provided a consult line. A clinician like myself can attest on behalf of you to immunologist or vaccine expert, and they can provide guidance as well.
Okay. So, Dr. Brand, I know that you and I have talked about masks in a previous conversation. Do they really help? And so, I myself, I've been vaccinated. Tell me about, should I wear a mask yet?
Yeah, so those are great questions. It's kind of an old question. The answer is yes. I've been wearing a mask in surgery forever, so they don't bother me so much, but we do know that masks do help. And in the past, we knew that they would help protect other people. We also know that masks can even help the person that's wearing it now. So there's growing evidence of just how effective a mask is. Once again, we've known that because we've worn masks in surgery for many years, and it's been studies that were done a long time ago that proved that mask wearing in surgical cases to maintain sterility is a great thing to do. It makes all the difference. We're very consistent with that, and so we know that when we use those things in the surgery arena, it makes a difference. And when you can wear those things in the community where it's necessary, particularly inside where you're in close proximity to people that may be contracting the illness, it's very important as it protects other people if you're carrying it unknowingly, and it protects yourself as well as if you're around people that have the illness. So the long answer to yes, it works.
All right. Well, this has been very informative. Have I missed anything through our discussions that, you'd be like, Ken, we probably should have talked about this?
Yeah, no, I think just reiterating the things that we've said, we're here to answer questions. We aren't tying anybody down and making them get a vaccine yet. No plans to do that. But we really love to answer questions about any medical concern. And our healthcare providers want to take care of all the healthcare concerns that our patients have. And sometimes I know that the barrier of the vaccine for some people has even prevented them from coming to the hospital because they don't want to get into the discussion because they feel like they don't want to have that discussion. And we just want people to know that we don't care how they feel about a vaccine. If they're sick, we need to take care of them. We would love to take care of them. We're not going to force them to talk about the vaccine if they don't want to. If they don't want to talk about COVID, we're okay with that. At the same time, we would love to be able to answer people's questions if they really want to have a serious discussion about the simplicity of a vaccine and the basic science behind vaccines and how they can protect us from viruses like COVID.
I think the biggest thing is that there were concerns that I reach out to the CDC. I think it's very important where you get your information from. I'm reading, I'm sure as well as Dr. Breon, this consumes the majority of our time. Every day, hours of review of the latest, what's best for our patients and what's best for our staff. And a great resource is the CDC. And so if you're not sure or you're having difficulties interpreting guidelines or what's best for you, call in. We can go through these, as well as specific vaccine questions. It's been unfortunate that people may have been stuck with something that they heard or read somewhere, and they really just aren't sure. And keep in mind that we're approaching flu season. You can get your flu and COVID vaccine at the same time. We're trying to make it even easier to get your vaccines here in the community. The other thing is I'd really encourage have these conversations with your primary care providers to start, because you're not fully vaccinated until about 6 weeks, and flu season is upon us. And so it's very important to start having these conversations now.
All right, all great advice.
And that's also a thing to consider. You're probably going to want to get the flu shot when it's available too.
Yeah.
We think the mask helped us last year with the flu, plus some other virus-related things that probably drove the flu down just because of the competition with coronavirus. But the vaccine for flu shot will be around, and we're going to encourage people to continue to get that as well.
My layman's observation last year was I almost heard of no one with the cold or the flu, so evidently there must be something to that.
Masking, social distancing, staying home when you're sick, and vaccination. That's what we need.
And they helped last year.
They helped last
in
year.
that regard, yes.
All righty, gentlemen, I appreciate your time. And so once again, I'm Ken Olson with Oskaloosa News, and I'd really like to thank Mahaska Health and their professionals for sitting down and helping go over some of the most recent COVID information.
Thank you, Ken.
Thank you.